Hello, everyone. This recording is going to cover sampling. How do we get people to be in our quantitative research studies? So first, that's a keyword, quantitative. Everything I'm covering in this recording deals with only quantitative studies. And right now, we're just going over sampling. Sampling has to happen first in quantitative. And basically, all sampling is how do you get people who have agreed to be in your study? So first of all, let's go over some basic concepts related to sampling. First of all, your population. What even is that? Well, first, that corresponds to the P in the PICO question. And the population is generally a big umbrella for what type of people you want to generalize your findings to. So for example, if I'm interested in learning about type 2 diabetics who have severe peripheral neuropathy and at least one amputation in the past, that's my big population. There's no way I could possibly ever talk to or survey everyone who meets that definition. So I can't possibly access or talk to all type 2 diabetics who have severe peripheral neuropathy and a history of at least one amputation. Impossible. That's who, though, I want to learn about is that big population. Once I learn about them, then once I learn about my little sample, then I can hopefully expand what I've learned to the bigger umbrella population. So sampling is selecting a small portion of that population that's going to then represent the entire population for my purposes of my study. And most of the time, when researchers are developing their sampling strategies, they have eligibility criteria. So I just, in my example, gave you some eligibility criteria. In my study, I only want people who are type 1 diabetics. So I would exclude those who have perhaps type 1 diabetes or those who have gestational diabetes. That they would be excluded. Also, they have to have had at least one amputation. So that's one of my inclusion criteria. And if they don't meet that, then they cannot participate in my study. And then lastly, I said that they had to have severe peripheral neuropathy. So there would have to be some kind of way for me to have a grading of these individuals' peripheral neuropathy. And they would have to reach the severe level in order to be in my study. Sometimes if researchers are doing like surveys and they're going to be written in the English language, they may exclude individuals who cannot read and comprehend English. So that's a common exclusion criteria. So those are just some examples. And as you dig through quantitative studies, you're going to see all of this sampling stuff talked about in the method section, that second part of the study article. Some other concepts, strata, that's kind of like a subsection of your population. So there's an example, gender perhaps. Maybe I would want to look at, in a classroom setting, perhaps junior versus senior, or GPAs over 3.5, GPAs less than 3.5. However I want to break up that group of individuals, I can. And it just depends on what my research question is as to whether I'm going to use strata, and if I do, what kind do I need? So just a couple more definitions, and I have a picture of this in a minute for those visual folks out there. The target population, again, is a huge group of people usually, and that's everybody I want to learn about. Now, I can't, so who do I have accessible to me? Maybe I have contracted with a couple of primary care providers who take care of type 2 diabetics, maybe some endocrinologists, or some surgeons who've done amputations before for diabetics. And I have their roster of patients that I've been allowed to have access to so that I can contact those patients and ask them if they would like to participate in my study. So that's my accessible population. I have a group of people who I actually could physically contact. Of course, I can't contact every type 2 diabetic with neuropathy and an amputation. So again, as I mentioned, for my visual folks, the target population is that huge subsection of people, or huge group of people. And that's to whom I hope to generalize my study findings to. A smaller piece of that is whom I have access to. That would be the accessible population. That's all of the patients of those 3 physicians whom I've networked with. Once I have those participants' names, I can list them all in order, and then I can choose from them to find those who have agreed to be in my study, and that's the sample. The sample is people who have met all of the criteria for inclusion and have said yes and signed consents, and they're on board on your study. That's the sample. It's a smaller group. So the main thing I want you to understand is in quantitative research, a major goal is that we want a representative sample. That representative sample is important because remember, my sample's small, my big population's big. I need to make sure that my sample, maybe 250 people, actually looks like what the big population looks like. So if I over or underrepresent people in my sample, then I don't have a representative sample. And we'll see some examples of that in a minute and talk about how we can hopefully improve our odds of getting a representative sample. Okay, so one of the easiest ways to get a representative sample is to use probability sampling. And probability sampling is also known as random sampling. There are several types of that, of which I have definitions and examples of later. Also, the bigger your sample in a quantitative study, the better, because it's more likely to represent a broader group of people because it's bigger. Okay, so oftentimes studies have some form of sampling bias. That means we've either over or underrepresented some segment of the population, and therefore we don't really look like the population with our sample. So hypothetically, I just made up some data. I was too busy to actually look this data up, though I probably could find it. So let's say that of the undergraduate student population of all of McNeese, that would be all degree plans, all colleges within the campus, let's say that hypothetically 46% of the students enrolled in undergraduate studies are male and 54 are female. I don't know, I just made that up. And then let's also say that we have a lot of non-traditional students of which 37% are over the age of 30. So I could figure that out based on data from the registrars or admitting office. But let's say I wanted to use my Nursing 390 class to collect data and then use that to make generalizations about the whole student body of McNeese. And let's hypothetically say that this is what our class looks like. Again, I just totally made up numbers because I can't. So let's say our class is 83% female and 17% male. So if you compare our sample, the small subsection, versus the population, the big group, then we have definitely overrepresented females and very much underrepresented males. So do I have a representative sample? Not even close. So that's a major error there. That means it would be very difficult for me to take the results of whatever study I did with my little Nursing 390 class and estimate that those would actually work for the whole student population, because it wouldn't. So there are 2 major classes of sampling: non-probability or non-random, and probability or random. And we're going to go through both of these and kind of show you the different types and give you some examples. And I'll tell you which ones are pretty common in nursing research and which ones are not. So for non-random or non-probability, there are 4 types listed in your textbook, but we're really only going to go over 3 of these. I'm purposely not going over purposive or purposive, depends on who you talk to, because really that's handpicking, and that's often done in qualitative research, much more so than it is in quantitative. So I'm not going over purposive right now. When we get to qualitative sampling, I will definitely cover purposive. So let's first look at convenience. And it's exactly like it sounds. It's convenient. So again, this is very commonly used in nursing and healthcare literature because it's easy. But look at the problem. It's the most vulnerable to those sampling biases. Remember, those sampling biases are when we over or underrepresent segments of the population, which means we don't have a representative sample. And wasn't the whole point to have a representative sample? So then why do we use this so much? Because it's convenient, it's easy. So you will see this kind of sampling used a lot in nursing research. And anytime you see a study with convenient sampling, that should be a red flag like, uh-oh, there's some problems here probably. Somebody's over or underrepresented, okay? And I put a little Christus area here because of an example. So let's say I'm interested in looking at patient satisfaction trends in the emergency departments in Louisiana. So I want to know how Louisiana folks who use the ER feel about the services they typically receive. So out of convenience, because I have a preceptor student in Christus Ochsner Lake Area's ER, I could just use that hospital and say, okay, that's going to be my sample. Anybody who walks through the doors and has seen a provider and gotten treatment, I'm going to ask them if they would be willing to participate in a brief survey after they're on their way out. Is that representative of every person who has used emergency services in the state of Louisiana? Definitely not. One, you got to think Christus Ochsner Lake area is a relatively small emergency department compared to others, even in this city, but even in this state. So I would probably definitely need to go to some big trauma centers, maybe in New Orleans and Baton Rouge, and some really rural emergency departments as well. The broader I can get, the more representative my sample would be. So just because it's convenient doesn't mean it's good, but we do it because it's easy and it's cheap. Okay, quota sampling is a form of convenience sampling that actually uses strata. Now remember I defined that for you earlier. A strata is a subgroup. If I'm interested in seeing differences between two or more different groups or classes of people, then I could split things up. So that is one way to make convenience a little better because it's convenient, but I'm making sure I'm meeting the quota in my strata. If that makes 0 sense, this will. So this is just random numbers. So this doesn't represent anything. So let's say I know my population information. Let's say this is all of those type 2 diabetics with the neuropathy and the previous history of amputation. So let's say of those folks, 80% are female and 20% are male. That's actually probably not right. It'd probably be opposite if I'm guessing. So that is what my population looks like. So out of convenience, if I just went to those specific endocrinologists that I know and looked at their patients, maybe the only people who get back with me would be 95% female and 5% male. We've got major issues there because we've severely underrepresented our males. And so we're not going to get good data that looks like the population. If I instead used quota sampling, and let's say I knew I wanted 100 people in my study, I easily know that I've got 80% female and 20% male in the population, and I can look up that information. There are ways that you can get some information like that. Then I would know that I would need to keep sampling until I get 20 males and 80 females. That's my quota I have to meet. So I can't be finished collecting data until I get the right proportions of the population. And that's an example of quota sampling. It's not random because I'm still just waiting on these people to call me back. And I'm going to continue to keep my sampling open and maybe reach out to other endocrinologists until I can get 20 males and 80 females. Okay, the last type of non-random sampling we're going to talk about is called consecutive. This is very common in hospital-based research studies. So let's think about this example. Let's say I'm interested in studying some sort of COVID. We'll use COVID. So let's say I'm interested in studying whether proning, putting people on their stomach, is an adequate solution for oxygenation and preventing them from having to become intubated. So we've got people who come into the inpatient facility and they have low oxygenation. Before we resort to intubation, I want to see if putting them on their stomachs will help increase their oxygen levels and avoid ultimate intubation and ventilator assisted breathing. So what that means is, let's say I decided on April 1st, when all this COVID stuff really started hitting, April 1st, anybody who comes in who meets my criteria, they're going to be in my study. I'm going to pull their clinical records, get them to approve, and we're going to move forward, and they're going to be in my study. And my study is going to stay open all the way until October 31st. That's consecutive sampling. You set a specific start and stop date, and anybody who meets the criteria between point A and point B is asked if they want to participate in your study. So think about labor and delivery. The same thing could happen. If you wanted to study the different parent perceptions of cord blood banking, and you wanted to give every mother who delivered vaginally and cesarean between January 1st and December 31st of a calendar year, a survey to ask them their opinions using a Likert scale about cord blood banking, then you could use consecutive sampling. So the main thing here that I would tell you is that this bottom bullet point is important to consider. Sometimes we face seasonal fluctuations in nursing. For example, think about respiratory season. Usually October, we start seeing flu. I'm not talking corona. I'm talking about like normal time. We start seeing a lot of flu and respiratory issues, and it continues to increase as we get toward November, December, January, etc. In the emergency department, we see a lot of certain types of accidents in the summer, like boating accidents, heat injuries. We see a lot of like contusions and different things during football season. So the deal is, if you are going, you got to make sure that your window of time for data collection is big enough to where you're capturing those seasonal fluctuations. Okay, so you don't want to just keep your sampling open for a month, because what happens if next month you're slammed with people who need proning, and you already closed your sampling, so you might not represent your population. So that was all non-random. That means we purposely sought out people because they either were at the right date or at the right place. With probability, it's not. This is totally random. And in order for me to have random sampling, you see this phrase, sampling frame, I have to have a list of people who belong to the population, and then I pick randomly from there to be in my study. So let's look at an example. That is called a sampling frame. I do want to talk about this bullet because this is confusing to students typically. Random selection is what I'm talking about here. So that means out of everybody in my class, I have to be able to have some kind of random way to pick who's going to be in my study. So I can't put any rules on that. Like, I can't say, okay, I'm going to hand pick 5 people that sit in the top left of the classroom, 5 people who sit toward the bottom middle, and 5 people who sit on the right side. Every single person in the class or in my sampling frame has to have an equal opportunity to either be in the study or not be in the study. So think about drawing out of a hat. If there's 20 people in a class and I need 10 people, then there's going to be 10 X's and 10 O's, and all of them are folded up. And I shake the hat up and then I pass it out. And whoever has the X's are the people who are not going to be chosen for the study, and people who get the O's are selected for the study. That's really basic, but that's an example of what random sampling is. So I have made up a fake sampling frame. Let's say that this is 26 students who are in my class, and I need half of them. So what I could do is I could use a randomizer. It's a random numbers generator, and I have one linked below if you're interested in checking it out. And what I would do is I would tell it that I need 13 participants from a list that's numbered 1 through 26. And it's going to randomly pop out 13 numbers. And let's say number 15 is the first one that's popped out. Kind of like the lottery, like what number is going to come up. So number 15 means that Oscar Olivier would be invited to be in my study. And then the next one that comes up is 20. So Tisha Thomas is going to get an invitation. And then 4, Daniel Dugas, and so forth and so on until I got 13 people. But it's completely taken out of my hands, and everyone has an equal chance of being selected in the drawing, if you will. So a different second type of random sampling is called stratified random sampling. And guess what word we see here? Strata. So what if I wanted to keep the gender representative? So what I could do is I could make a sub list. So I would list all the males in the class, and then I would list all the females in the class. And then I could take 3 off of this list and 7 off of this list, or whatever the proportion would be. So that's the same process. You're just subdividing your list of people in the population into subgroups and then sampling from the subgroups. And then lastly, systematic sampling is also random. I put my fake list up here again. And what I would do here is I would actually use a random numbers generator to pick one random number. So let's say my random number is 21. So Umar is where I start. And then I would say maybe pick every third person starting at number 21. So that means Umar would be invited, then it would be Xander, then it would be Amy, then it would be Daniel, etc. So even though I know I'm picking every third person, I let chance decide where to actually start my sampling at. So 21 was the lucky number, and then you move forward from there. So that would be considered random, because randomly it made me start at a certain point of the list. Sample size is very important in quantitative studies. Basically, the more the merrier. That's always a good thing to have a big sample size. In fact, there is a statistical calculation that you can do that's called a power analysis that can tell you how many people you need in your study. That's a pretty cool thing to have. Basically, let's say I run a power analysis and it tells me I need to have 120 people in my study, and I'm doing an experiment. So that means I'm going to have 2 groups. I've got an intervention group that's going to get my intervention, and I have a control group that is not going to get my intervention. My power analysis calculation tells me I need 120 people in my study. That means I need at least 60 people in the intervention group and 60 people in the control group. And if I get at least that, then I can trust my statistical outcomes for my study. Okay? But if I don't have enough people, then I may get poor statistical conclusion validity. That's these words right here. Okay? So the better, bigger sample you have, the more you can trust what your statistics say about your hypothesis. If you fail to reject your hypothesis, then you need to know that you had enough people in your study. So power analyses are very helpful. I wish more people did them. There's an easy calculator you can do online, but most people don't do them, and I don't know why. So that's definitely a weakness in a lot of studies you're going to see. Here's an example of what I was talking about from an actual study. So these people, these researchers did a power analysis, and they determined that in order for them to capture their statistical conclusions correctly, they needed at least 242 people. That means 121 in the control group, 121 in the intervention group. Now, here's something to think about. People often drop out of studies. So you don't want to just play it loose and risky and go get 121 per group. You want more than that. You might go 150 per group. It never hurts to have more people. But if you go for 121 and let's say somebody decides, I don't want to do this anymore, you don't have an adequately powered study. So a couple of things to think about when you're reading a quantitative study, and you will be doing this because this is exam 2 for you, but also you're going to do your individual synthesis table assignment on a quantitative study. These are some of the things to think about. First of all, what kind of sampling did the researchers use? Oftentimes they don't come out and tell you that, so you're going to have to use these lecture notes to deduce what kind of sampling they used. Now, if they used random sampling, they're going to tell you that, okay, because that's exciting. That's a strong sampling design. So if they did random sampling, you'll know about it. But if they didn't, then you're going to have to look and see, did they sample from like January to December, or did they just go to a certain nursing home and pick people out of convenience? So you'll have to make that decision. They usually will give you their inclusion or exclusion criteria. So in order for people to be in our study, they had to meet the following criteria. And then the following people were excluded from the study. They should tell you what their final sample size was. So that should be in there. And if they did a power analysis, they should tell you about that. And then the last thing you'll see is an actual description of what the sample looked like. So that's some demographics. They may tell you the mean age and standard deviation. They may give you proportion of gender. They may give you clinical status, like what was the average severity of peripheral neuropathy, or what was the average number of amputations in each participant in the study. So those types of things you would see. And so now that we are finished introducing the content, we're going to do a quick self-check. I want you to see if you can figure out the answers to these questions. I'm going to give you a fake study and tell you how the sampling was done. And you're going to tell me, or you're going to figure it out yourself, you're not talking to me, whether you think it was non-probability, non-random, or random. So let's figure it out. Well, I told you the answers on the slide. Okay, that's fine. Solomons studied circadian rhythms in a sample of 45 pregnant women consecutively. That's a key word. Admitted to a hospital in the first 6 months of 2013 because of severe preeclampsia. So basically, January 1st to June 30th, any woman who came in and had a diagnosis of severe preeclampsia, then this researcher went and asked them, hey, you want to be in our study? And if they said yes, they became part of the sample. And if they said no, then they weren't part of the sample, because it would be unethical to include them in the study if they absolutely refused. So that would be non-random, non-probability, and specifically that's consecutive because we have a date, a start and an end, and that tells you it's consecutive. Okay, so Kane sampled every 26th nurse on a roster of those nurses in Florida to study their use of personal digital assistants. And the number 26 was selected at random. So that's systematic sampling, where you have the list of all Florida nurses and you pick one number, 26. And then you move from there and find every 26th person, which means it's probability sampling or random. Okay, this is our last one, which I told you the answer. Marshall randomly selected 250 students from a big university to study their use of drugs and alcohol. So we know first they give us the word random. Okay, so they're proud of that. That's good. That means it's random or probability sampling. And basically, they don't tell us anything about quota. They don't tell us anything about strata. So this is just simple random sampling. That means I would have gotten with the registrar's office and gotten a numbered list of every student currently enrolled in this university. And then I would have randomly chosen numbers and found the students' names who correspond to those numbers and invited them to be in my study. So that is it. That was the beginning of chapter 10, the sampling portion. There's going to be a separate recording that looks at how we collect quantitative data once we actually have people to be in our study. So thanks for listening.